Hi, I'm Katie Thalberg, and I'm the Dental Assisting Program Director at Central Lakes College.
Hi, I'm Karen Middendorf, and I'm a dental assisting instructor here at Central Lakes College.
And today we're going to be talking about oral hygiene and how it's about your teeth, but it's also about so much more than your teeth. And so our objectives are we're going to teach you about the basic knowledge and techniques of proper oral hygiene care. You'll learn about oral disease and its importance to oral health and your overall health. And then you'll learn about proper nutrition and its relationship to your oral health and your overall health. So first we're going to talk about the basic purpose and techniques of oral hygiene. And we have a quiz question for you. And our question is, true or false, are cavities and gum disease contagious? So can you catch it from someone else? So do you think that's true or false? And it is actually true. And so we always say, be careful who you are swapping spit with, because you can trade that.
Yep, that bacteria, either cavities or gum disease. Yep, or who you share your toothbrush with or drink water out of. Yep. So yeah.
All right, so we're going to talk first about the purposes of oral hygiene. And you'll see in the pictures that the purpose of oral hygiene is to remove dental plaque. And we all have plaque in our mouths. As soon as we're a baby and we're born, we start accumulating bacteria from our environments and we develop plaque. And so plaque is a sticky, colorless film of bacteria and other byproducts in food. So plaque buildup, it can cause tooth decay and gum disease, and we'll talk about those a little bit more later on. When left on our teeth, plaque hardens. Every 24 hours we get new layers of plaque if we don't clean them off, and it hardens into calculus. And that can worsen gum disease and contribute to bad breath and all of that. So benefits of good oral hygiene, and not just having healthy teeth and a healthy mouth, it also benefits us to help us speak clearly, to taste, to chew, and swallow delicious, nutritious foods, which Karen is going to talk about a little bit later. And then it also helps show our feelings and our confidence through our facial expressions and smiling, and just builds that confidence. Healthy mouths also help benefit our overall health, the rest of our bodies, and we'll talk about that as well.
Okay. All right, so I'm going to start off with this quiz question. What do you think the hardest substance in the human body is? You think it's bone, your fingernails, the enamel of your teeth, or all of the above? Well, actually, the answer is the enamel of our teeth. So, which brings me to the next subject, is cavities. So, as cavities, they can weaken or soften areas of our teeth, and it's caused by repeated acid attacks to your teeth. And I'm going to describe a little bit more about that when I talk about nutrition. But what can happen is that these decay or cavities in your teeth, they can progress further and further, and they can cause really extensive problems. So the key is to catch those cavities when they're small and early, so that they don't build up to extensive problems. Cavities, otherwise known as tooth decay, they're actually among the world's most common health problem there is. They're especially common with children, teenagers, older adults, but anyone who actually has teeth. So even babies can get cavities. So basically what a cavity is like we said, it's acid on your teeth. So if you have sugar or even like carbohydrates, like people don't think about crackers and other things that we eat, those break down into simple sugars. And then the bacteria that we just naturally have in our mouth, they form this acid. And this acid actually will go to your healthy teeth, and even though enamel is the hardest substance, that acid will break down that enamel and start causing decay. So the earlier you can catch it, definitely the better. All right, Katie, I'm going to let you talk about gum disease, and we'll get back talking about nutrition and cavities later.
All right, so we talked about this plaque can cause cavities, and it can also cause gum disease. And many, many, many individuals, I think it's over half of the population, have some form of gum disease. It can be simple gingivitis, which is redness and irritation of the higher levels of the gum tissue, and it can progress if we're not cleaning off that plaque and the calculus build up on a regular basis. It can get deeper and deeper and cause bone loss, and you can actually lose teeth from periodontal disease as well. So gum disease is caused by plaque and our body's inflammatory response to it. So it's not just the plaque, it's also how our bodies respond if we're not cleaning it off properly. So we're going to talk about some basic oral hygiene techniques to get rid of this plaque buildup. We want to brush twice a day, so morning and nighttime for 2 minutes each time. It can be helpful if you listen to a song on your phone or something just to make that time go a little more quickly. Sometimes I will walk around the house and be picking up the house while I'm brushing my teeth.
Sometimes people brush in the shower.
Right.
So just gonna make it convenient for you, just as long as you're getting the brushing done.
Yep. And then I'll show you the technique we want to use in a minute. We also want to floss or clean between our teeth on a daily basis as well to disturb that plaque, because every 24 hours it's reforming, so we want to remove it every 24 hours. We want to use a toothpaste that has fluoride in it, and fluoride helps our teeth, those soft areas that Karen talked about, it helps those remineralize and protect them from cavities. So let's talk about our brushing technique. And so with our brushing, the plaque likes to sit near the gums, and because it's warm and it's protected, there's lots of nutrients, and so you want to actually angle your toothbrush towards the gum line. We wouldn't be able to come in from the back of the head though, we got to come in from the front. So angle towards the gum lines and then use circular motions and make sure that you get all the teeth near the gum line. So work through your whole mouth on all of the surfaces. So the cheek side, and then you want to go into the inside and get that gum line surface. And then go down and do the same on the bottom, the cheek side, the inside, and then don't forget to get the chewing surface as well, both on the top and the bottom. And so you want to spend about 2 minutes total going through that sequence. And then don't forget to get your tongue as well. We have papillae, which are kind of like hairs or taste buds, and they catch a lot of that plaque as well. So make sure to brush your tongue and get that off.
And get that bacteria out of there as well.
All right, and then we've got some other, we talked about flossing, so you can certainly use string floss. Some people find that a little bit inconvenient though, so there are other options that are very affordable. You can get little flossers, little flosser sticks. This is another flosser option that's available at your grocery store or Walgreens or wherever. This one has a replaceable head, so after that wears out, you can pop that off and then pop some new ones on. So that's a nice option as well, especially for dexterity and getting back where you need to. And there are other little brushes that you can use between your teeth if flossing is not your thing. It's just the idea to get in between and disturb that plaque so it can't cause problems. Okay, so that's the basics about oral hygiene and how to take care of your mouth. I didn't touch too much on mouth rinses. They are okay, they're good. However, the most important thing is to physically remove that plaque. It's sticky, and so you really actually need to use something physical like toothbrush and
even
floss.
if you did not have toothpaste for like, you know, it's okay to even just brushing it off without the toothpaste if you don't have any on hand. Just getting in there and just brushing it, and make sure you have a soft toothbrush too. Because if you have a too stiff one, a hard one, that could actually do some damage to your teeth. So a softer one better, but just getting in there and removing it. And you don't always have to have toothpaste if it's not always available. Yeah.
So mouthwash would be an added bonus, but it's not as beneficial as actually brushing and flossing your teeth. Okay, so to shift gears and talk about how our mouth relates to our overall health, the rest of our body. You may think that they aren't connected, but there's more and more and more research that's coming out that's connecting our mouth to the overall health of our body. And so there are things like Alzheimer's and dementia, strokes, heart disease, diabetes, rheumatoid arthritis, cancer, obesity, respiratory disease.
And like preterm birth for pregnant women, we can have early birth.
And a low birth weight baby, so not as healthy of a pregnancy and not as long of a pregnancy. So it's really important. Our mouth has a big impact on our body and vice versa. If we've got some health conditions that aren't very healthy in our body, it can impact our mouth. So it's really important to have good oral hygiene to help better the rest of the conditions in our mouth as well. All right, on to nutrition.
Right, so nutrition and its relation to dental health and overall health. Katie talked about that, and I'm going to talk a little bit more about nutrition in general. So I have another quiz question for you. Is this true or false? So let's say you eat something with like carbohydrate, sugar, an acid attack occurs on your teeth for 45 minutes afterwards. Do you think that's true or false? If you eat something, you think that it's going to continually break down those teeth for like 20 to 45 minutes? That answer is true. Kind of mentioned that earlier. So that's why it's so important to pick the nutritious foods and be careful to stay away from the high carbohydrate and sugar foods as much as possible, or snack less, because each time you put something in your mouth, it's attacking, the acid is forming and attacking your teeth for at least up to 45 minutes. So if you keep eating something, you're not giving your teeth a break from that attack on your teeth. So it's good to give yourself a little break. Now I'm going to move on to another question regarding acidic things that are in foods. So nutrition, oral, and systemic health. So true or false? Acidic drinks aren't bad for your teeth. So let's say, well, I can drink this. There's no sugar, but what if it's high in acid? Do you think that would be better? The answer is false. Acidic drinks, they are bad for your teeth. You know, a lot of times, like our, marketing, they're really good about marketing. It's like, this is sugar free, but people forget that even if it's sugar free, that there is that acid content that they need to watch out for. So that is just as harmful on our teeth as the sugar. Even though if it says no sugar, I mean it has the high acid, that will affect your teeth. And the reason is, so acidic drinks, they are loved by many, but can be very tough on our teeth if consumed regularly. So a drink's acidity level is determined by how much acid it contains from the citrus acid or other additives. So I don't know if you've heard about pH levels or measurements. So basically a pH of 7, that's neutral. But if you have acidic drink that's below that, it's the more acidic it is. Let's say it's like a 5.4. There's even some drinks that have acidic level of a 2 or 1. That's basically like drinking straight acid on your teeth. So you got to be careful for that, because it's very harmful. The lower number on your teeth. Enamel is the strongest and protects our teeth, but acidic drinks can wear down that enamel, and it can cause long-term tooth erosion. So kind of like the soil erodes away from the wind and the rain, well, the acid can kind of do the same thing to your teeth. Over time, it'll just erode it away. So as enamel is not a living cell like our skin, so it doesn't naturally repair itself like skin does. So once you get it eroded away from having too much acid, it won't repair itself. So here's some tips though, that because I know everyone likes to have a beverage once in a while, like a nice drink or a nice pop. So tips to protect your teeth from acidic drinks. So the first thing is that I like to share with my patients, it's just to do it in moderation. Many people will consume acidic drinks on occasion, so just to limit your amounts, just have one. I always tell patients that maybe replace every other one with a glass of water, so then you're not having as much acid on your teeth. Another good tip is once you get done with that acidic drink or drink that has a lot of soda or sugar in it, rinse with water. So just rinse it, and then that'll kind of help cleanse the mouth as well. And then this is a kind of little trick, reach for a straw. So when you're drinking through a straw, it's not getting all over your teeth. So that helps. And this is another tip that a lot of people don't realize, but it's also a good idea to wait to brush your teeth right after you get done drinking acidic, because remember I mentioned earlier that when you put something in your mouth that it's attacking your teeth for 20 to 45 minutes. So if you brush your teeth right away after you drink something acidic or sugary, you're actually eroding away your enamel. It's making it soft. So it's good to wait after you eat or drink before you brush for at least an hour. And then this is, I feel, is like the most important. I know it's just to build those healthy habits, just kind of challenge yourself. And as we know, water is plentiful, and water is like the best beverage for our mouth, teeth, and our overall health. So the more water you can drink, and it's free. You can get water anywhere. Just make sure you drink lots of water. It'll keep you healthy. It'll keep your bones healthy. It'll help you feeling better. And like I said, and after you decide to have a pop, just drink some water after, and that'll help neutralize it. And also dairy products, they can provide a protective film on the enamel that helps prevent cavities as well. So drinking and eating more dairy products helps.
They have calcium.
The calcium to help build, yes.
Remineralize.
Yes, yep. And then chew gum that's sugar-free. So if you chew gum, make sure it's sugar-free. And sometimes there's actually a component called xylitol, and the xylitol in the gum actually helps prevent caries or cavities as well. So I know Icebreakers is a brand name that has xylitol. That's one I like to chew. So yeah, so then instead of like putting like an M&M or a piece of food in your mouth, put a piece of gum, sugar-free, and then that'll help get you through so your teeth are not constantly attacked with acid. Practice good dental hygiene. That's like Katie explained, take your time to brush, at least 2 minutes, do it twice a day so you're removing all that plaque. Like I said, it's, when you do use toothpaste, use the fluoride kind, but if you don't have toothpaste available, just getting in there and just disrupting that plaque and bacteria is helpful. And then be sure to floss, getting in between the teeth or using those little picks like Katie mentioned, that'll help greatly. And it doesn't really take that much time once you get in the habit of it. So, and then, if you have a chance, talk to your dentist. Consult with an expert on the safest options your dentist can advise, dietary choices for your long-term dental health.
And just back to those
Yes.
like acidic drinks, if you're not able to reduce the amount, say you really love your Mountain Dew and you drink a few cans a day, it's better to drink it all at once versus sipping on it all day long, because every time you take a sip, you're getting that bacteria eating it and then creating that acid attack. So try and drink it faster. I don't know how the effect on the rest of your body.
Then rinse your mouth. Yeah,
right.
So just drink it all down if you're going to have one,
right.
and then be done.
Right.
So here's some little statistics too that just shows like some beverages. It shows you how much sugar is in certain beverages. A lot of people think, oh, I'm drinking iced tea. This probably is healthier because, there's not as much sugar. But if you look, this Lipton iced tea, this shows you that how many tablespoons of sugar it has in there. Probably, I'd have to look at the actual nutritional value, but I'm guessing this is at least like 5 tablespoons or more of sugar. Sprite, look how much sugar is in there. And even Gatorades, a lot of people are fooled by energy drinks. They actually have a lot of sugar, hidden sugars that they think it's the healthy drink. Well, it is where it can replenish your electrolytes, but not so healthy when it comes to the amount of sugar. And then root beer, even like Capri Sun, it's a juice. A lot of people think, oh, it's juice? There's probably just all the natural, but a lot of those juices, the natural sugar, but they also have a lot of hidden added sugar as well. So you got to be careful for those. Hey, Katie, what are some examples of acidic drinks?
That's a great question. I know it can be confusing for sure. So we can think about coffee. Black coffee has high acid levels. Any of our diet pops, Diet Pepsi, Diet Mountain Dew, we may think that's a healthier choice because it's diet and it doesn't have sugar, but if you look at that nutrition label, it's got phosphoric acid or citric acid or ascorbic acid. So definitely be checking those, because every time we're taking a drink of even our like diet Red Bull or sugar-free Red Bull, it's got that acid attack, and so it's softening our teeth and contributing to cavities over and over and over. All right, well, thank you very much,
Yes.
and we wish you all the best with your oral health.